Yes, Manir.
We'll start off with some introductions so that the Honorable Vice President knows who is here. We'll start with you.
Okay. Good evening. My name is Zino from Newsday Zimbabwe.
My name is Marshall Bonya. I'm a freelance journalist.
My name is Yashita Shindula. I'm a freelance journalist.
My name is Desmond Munemo, H-Metro journalist.
Robert Tafmani, Sly Media.
Anashima Kopa, freelance journalist.
Put our masks.
Flavin Manyota, attention. Flavin Manyota, attention.
Innocent Mapao, Sunday Mail.
Sunday Mail. Mobile Sunny, News of Africa.
Lord Machare, Daily News.
Moses Matenga, Newsday.
Maxwell Tapatapa, Star FM.
Fraser Mkono, Zampef Information. Honorable Vice President, today 6-2 research, live streaming, the Daily News.
Newsday.
Newsday, one. Live streaming. Today, what is the I think you guys, you all know our permanent secretary, and then Dr. Desmond is the national coordinator, also the president cabinet. Then the chief director, policy, planning, modern evaluation in the ministry. Dr. Matthew, also chief director, security executive in the ministry. Then the GP's office. Let me now hand over to our permanent secretary to take the next step. Over to you, please.
Honorable Vice President, years of welcome, we want to welcome you to this occasion where you've taken time off your busy schedule to come and update the nation on the current situation in terms of COVID-19. With us to witness this occasion, our members of the press is introduced by Mr. Mjiru, our PR manager. And we want to take this opportunity to share the experiences that we've encountered and the measures that we are going to take at this juncture. Thank you, sir.
Thank you, PS. The Permanent Secretary and the Minister of Health and Child Care, Air Commodore Dr. Jasper Chiwenga, our National Coordinator of COVID-19 in the Office of the President and Cabinet, Dr. Agnes Maomba, Dr. Mjiradima, Dr. Maxwell Hoge, and the staff, members of the 4th Estate, good evening.
Good evening.
Measures to curb the surge for COVID-19. Fellow Zimbabweans, the country has done very well in terms of curbing the spread of COVID-19. In addition, our vaccination against COVID-19 is going on very well. The country is, however, experiencing a surge in cases. The last 7 days have seen 596 new cases and 26 deaths as compared to the same period in May last year, where we had 132 new cases and 6 deaths. This is more than fourfold increase in new cases and deaths. Sadly, it has been noted that there has been a general complacence in adhering to the preventive measures both in the communities and workplaces. We are also witnessing a sharp increase in cases and deaths globally and in the SADC region. In order to keep this stage, the following measures will be implemented effective Monday, 14 June 2021. There will be stricter enforcement of the following preventive measures. Mandatory wearing of masks in public places. Maintaining social and physical distancing. Washing or sanitizing of hands frequently. 3. Government will strengthen testing and contact tracing as well as quarantining contacts and isolating confirmed cases. 4. Regarding public transport, the operators are to adhere to recommended passenger numbers. They should ensure that all passengers are wearing their face masks properly. On boarding, they must have their temperature checked and their hands sanitized. Public transport operators shall disinfect their vehicles every trip. 5. With regards to gatherings, the following measures are to be implemented. All gatherings except funerals are banned. These gatherings include, but not limited to, weddings, church gatherings, music festivals, and sport activities. Funerals shall be limited to 30 people. All COVID-19 funerals will be supervised by health personnel. All workshops and meetings are to be held virtually. In addition, all offices, both government and private, are to decongest by 50%, except for offices connected with essential services. 6. With regards to retail businesses and shops, their operating hours shall be from 08 hours to 1800 hours. That is 8 a.m. to 6 p.m. It is expected that the operators ensure that there is strict adherence to preventive measures such as proper wearing of face masks, sanitizing, and temperature checks of their clients. They should also ensure that they limit the number of clients in their shops to maintain physical distancing. Beer halls and nightclubs will remain closed, whilst bottle stores will operate from 1000 hours to 1600 hours, that is 10 a.m. to 4 p.m. in the afternoon. Operators should ensure that there is no drinking in and around their premises. Failure to adhere to these measures will result in withdrawal of business licenses. Hotel and lodge bars and restaurants are open to their residents up to 2200 hours, that is 10 p.m. All other restaurants and fast food outlets will serve takeaways only. And I repeat, all other restaurants and fast food outlets will serve takeaways only. 7. With regards to the people's marketplaces, such as but not limited to Mbare, Rankin, Mpezanamo, Sakuba, Machipisa, and others, they shall close at 1800 hours, that is 6 p.m. The operators shall ensure strict adherence to preventive measures such as proper wearing of face masks, sanitizing, social distancing, and temperature checks of their clients. Non-compliance will result in closure of that marketplace. Our health inspectors and other law enforcement agencies will move around and monitor compliance to these measures. Failure to adhere to these measures will result in withdrawal of business licenses. 8. With regards to tobacco auction floors, the owners must ensure strict adherence to preventive measures such as proper wearing of face masks, temperature checks, and sanitizing of clients and maintaining physical distancing. Each consignment of tobacco bales to be accompanied by at most 2 people into the auction floor. Targeted vaccination of tobacco farmers and their workers will be available. Tobacco auction floor employees are required to have a negative COVID-19 PCR or rapid antigen test, which will be valid for 2 weeks. Vending within and around the tobacco floors is prohibited. I repeat again, vending within and around the tobacco floors is prohibited. In other words, we want buyers and sellers at the tobacco floors. Our health inspectors and other law enforcement agencies will be monitoring for compliance. Failure to adhere to these measures will result in closure of that particular auction floor. 9. At all ports of entry, there shall be strict enforcement of the 48-hour-old PCR negative certificate requirement and mandatory testing of all travelers from hotspots, countries, or areas at their expense, regardless of their negative PCR certificates. There shall be quarantine of those coming from hotspots in designated quarantine centers at their own expense. Those who present with fake COVID-19 negative certificates shall be arrested and prosecuted. 10. With regards to management of local hotspots, the following measures shall be implemented. A. There will be daily national updates of hotspots as part of the daily COVID-19 situational report. B. The public is being advised not to travel to these hotspots areas. C. There will be increased testing and contact tracing within the hotspots areas. D. Vaccinations and health education will be intensified in the hotspots areas. And lastly, E. If the above measures fail to control the hotspots areas, targeted lockdowns will be effected in those areas. Finally, I want to remind everyone to properly wear your face mask, sanitize, maintain physical and social distancing, and get vaccinated. I thank you.
Thank you very much, sir, for enlightening the nation on the measures that the government is taking in order to mitigate the rising numbers in cases of COVID-19 and also the rising number of deaths. I'm sure the presser was very clear from everyone to everyone, and I'm not sure, sir, whether you want to leave the questions to us or you want to take a few questions yourself.
Yeah, I can take one or two questions. There.
The floor is open for you. Just 2 questions. Also, for number of time. Please identify yourself in the media house. If there is any. Yes.
Just a point of clarity.
Can you say your name? And your
My name is Nurul Sani, News from Africa. Just a point of clarity, Honorable VP, on terms of the curfew. Is the curfew still staying at the time which was around 11 p.m. to 4 a.m.? I've seen quite a number of changes on operating hours. Unfortunately, there was no mention of the curfew.
Okay, another one. Yes.
Maybe I just want clarity on issues of schools, also colleges.
Okay, we are going to do that for now. Can you repeat it? Can you repeat it? Okay.
I just want to understand the position on schools and also universities.
If I might answer the first question from Tansan, the time has not changed. 5:30 from 10 p.m. to 5:30 does not change. And your
Max.
Currently, schools are closed. We will review the situation for our students, both at tertiary and at primary and secondary education. We will review because they are still at they are still at enjoying their holidays, and if the situation changes and if it goes to the west, then we will implement, we will advise you what measures we will be taking.
Okay. My name is Moses Machenga from Newsday. Honorable VP, there have been concerns that complacency is starting from government level. We have seen recently pictures of some of the ministers posing for pictures with people from countries that are considered hotspots without putting on face masks and so on. Okay. Right, the last one.
I'm national for freelance journalist. My question is there any changes to industry strategy?
Sorry, repeat your question.
Is there any changes to industry strategy?
Right, I will start with you. There is no change, but if it is a hotspot, there will be changes. I think I've made it very clear that we want to limit people from to travel to the hotspot area. Why would you want to go there? I don't think you would want to go into a hotspot area, do you? And then bring that virus to your own family. First, you are endangering yourself. Second, you are endangering your own immediate family. And later on, you are endangering other innocent people who don't even know. So, as we have said, that there will be daily bulletins to advise the nation and all our citizenry about what the hotspots areas. We expect our people, as usual, that they are responsible and that they will take heed. The question which has been asked, you have seen people, when we go for a photo shoot, everyone, we take our masks just for that that time, and I don't think that's being irresponsible. We are only taking that's only a photo shoot, and that is it. Yes.
Yes, I want to be able to get clarity concerning. Yes, my name is Marshall Banya. I'm a freelance journalist. I want to get clarity on what you said concerning the ban of sporting activities. Does it only apply to high contact sports or also low contact sports?
Can you probably put your mask?
That's exactly what we are trying, even for yourself, to avoid. This situation is not a permanent situation. This is a temporary situation where we are trying to contain the situation. You will find that in some other areas, the spread of this disease is none. It is non-existent. They don't even know what what is happening. And so, when we are talking about the sporting activity, this is where we get super spreaders. And you will agree with me that if one person attends the sports here and it travels all the way to Mtaro or to Masvingo or to Grue from here, it goes spreading the disease. And this is what we are trying to avoid. So, to hold certain things temporarily will save us as a nation and will save us as individuals.
Thank you, Lydia. It may